This is Damian McNamara, Global Medical News Network. In a press briefing and follow-up interview at the American Society of Clinical Oncology meeting in Orlando, Dr. Edith Mitchell of Thomas Jefferson University in Philadelphia presented the findings of a study where she showed a skincare regimen given prior to colon cancer treatment with Panitumumab significantly reduced skin toxicities associated with this treatment. 29% of patients experienced a skin rash compared to 62% who did not receive this regimen ahead of time. Could you explain the exact regimen that you used in your study?
In our study, we demonstrated that administration of a skin treatment plan for patients given prophylactically prior to the initiation of chemotherapy, within 24 hours of administration of chemotherapy, that this plan decrease the skin toxicities that patients experience as a result of epidermal growth factor receptor inhibitor Panitumumab given with chemotherapy.
Can you tell me the dosage and how you gave it?
Yes. For all of the patients in the study, we recommended that they use a topical moisturizer applied to the face and upper trunk daily. There was a topical corticosteroid preparation, 1% hydrocortisone, and a topical sunscreen in the sun-exposed areas if the patient was going to be in sunlight for more than 30 minutes. And we actually provided the patients a kit that contained Lubriderm as the moisturizer and 1% hydrocortisone as the corticosteroid preparation. All of the patients also took an oral antibiotic, doxycycline, 100 milligrams twice daily, and they continued that during the 6-week treatment period. During this 6-week treatment period, this was the evaluation period. However, if patients' chemotherapy continued past that 6-week period, they would continue on the skin treatment regimen indefinitely as long as they were on chemotherapy and at risk for the skin toxicity from Panitumumab.
Can you tell me how debilitating this rash is for patients when they experience it?
The rash can be tremendously debilitating. Approximately 90% of patients receiving Panitumumab experience some kind of rash. The rash can lead to secondary complications such as infection, sepsis. It can cause treatment delays, and in some cases has even led to death secondary to infections. So it can be tremendously important. For some patients, it can affect the personal appearance and quality of life, such that there are some patients who elect not to even receive this therapy or may discontinue it electively because of the skin toxicity.
Do you think this regimen would be efficacious for other EGRF inhibitors as well?
Well, I can only speak about this study, and the study evaluated Panitumumab, but certainly the skin toxicity is related to a class effect, and thereby it is certainly feasible and has been utilized in other disease states with other epidermal growth factor receptor inhibitors, but this study focused on treatment with Panitumumab.
Thank you, Dr. Mitchell. This has been Damian McNamara with Global Medical News Network.